Hello friends, so AIIMS May 2019 has been done, and a lot of queries had come about the discussion of biostats question, which were like in this AIIMS exam we had seen around 18 to 20 MCQs from community medicine. Out of these 18-20 MCQs, 50%, that is 10 MCQs, were directly from biostats. So let's very quickly have a look at them because I'm also short of time. We will cruise through I'll try to cruise through all the reconstructed MCQs. So these MCQs have been taken with help of our very favorite students. They have got together and they have helped me reconstruct these MCQs. So without any delay, I'm going to discuss the MCQs. Please mind it, the options may vary, the style of the question may vary, the pattern of the question may vary, but the topic remains the same. So my motive is not to tell you the MCQ. My motive is not to teach you the MCQ. My motive is to prepare you that in case you get this question again in the future, you should be able to solve them. So here we go with question number 1. In a town of 20,000 population, total 456 births were there in a year, out of which 56 were born dead. So you can see that 56 were born dead out of 456 births. So total population that this question is giving me is 20,000, and they were 456. The number of births we can see is 456, out of which 56 were born dead. So how many were the live births? Live births will be equal to 456 minus 56. So live births is 400 live births. Done. The total deaths that were reported. So I'll highlight the color again. The total deaths were 247 deaths were reported, out of which 56 deaths were within 28 days. So that's important for me, that within 28 days, that is the neonatal death. The next thing is neonatal death. Is how many? Neonatal death is 56 deaths happened and within the first 28 days, and another 34 had died after 28 days, but 34 died after 28 days but before completing. So that means what? The question is trying to give you the post neonatal deaths. The post neonatal deaths the question is giving us is 34 deaths. So it's pretty simple. How many were infant deaths? I think anybody can calculate. Infant deaths is 6, 4, 10, 5, 3, 8, 90, 90 infant deaths. So that's very easy. The number of infant deaths is 90. So now the MCQ is saying to calculate the infant mortality rate. So I know the infant mortality rate is given by the formula number of infant deaths divided by the total live births in the area multiplied by 1000. So we know that the infant deaths are how many? We have seen the infant deaths are 90. We can see that the infant deaths are 90. We also know that the live births, we have already calculated the live births in the area is 400. So 90 divided by 400 into 1000, that will be my answer. So answer should be roughly around 200. I can see that there are two options, 225 and 197. Answer is 225 per 1000 live births. So that was as easy as that we needed to calculate the infant mortality rate, and there you go. The infant mortality rate is given by the formula infant deaths divided by the total live births multiplied by 1000. 90 divided by 40 into 1000 is 225 per 1000 live births. So that completes your question number 1. So I would like to mark option A. Let us see and look at the question number 2 very quickly. In a study with new treatment, they were reported 36 deaths or treatment failures out of a sample of 120. With a new treatment, 26 failures were reported from a sample size of 130. How many patients should be treated to avert one death? Many of you got confused in this. There is nothing to get confused. I think all the students who had attended my classes, we already did this in the class, that there is something known as number needed to treat. There is something known as number needed to treat. So there are 3 steps that I always teach you. There are 3 steps to be followed whenever you get the MCQ. First step number is make a box. So let me make a box. In a new treatment with this much, 36 deaths reported out of sample of 120. So in a study, there were 36 reported with a new treatment, 26 deaths were there. So in the control group, in the experimental group, with the new treatment, that is the experimental group, we can see that 26 treatment failures out of 130 sample. That is what the MCQ says. And in the control group on the or the previous treatment group, we can see that there were 36 deaths or treatment failures out of 120 sample. That is what the question is saying. So carry home messages, question is giving us all these things. Next MCQ, point number 1, make a box. So I will make a box in the experimental group and in the control group. The number of times the event or the death happened and no event happened. So I can fill up the answers in this. Experimental group, how many times the event happened? You know it from there. In the experimental group, 26 times the death happened. In total was 130. In the control group, there was total of 120, out of which 36 people got the event, got the disease or the death. So how many are remaining? So 130 minus 26. So 130 minus 26 is 104. 120 minus 36. So 120 minus 30 would be 90 and 84. Okay. So that is what I deduce from this question. So that was my step number 1. I have completed. Step number 2. Calculate the event, listen to it carefully, event rate in experimental group. That is known as experimental group event rate. We call it as EER. EER is event rate in the experimental group. So how much is the event rate in the experiment? How many deaths did it happen within the total? That's what it technically means. So how many deaths you can see? You can see 26 deaths divided by 130. So let me just take a calculator and find out how many deaths would happen in this area, in this group. So we can see that 26 divided by 130. So that comes out to be 13. No, that was easy. It had to be 0.2. So next I would like to calculate event rate in control group. Event rate in control group, we call it as control group event rate, CER. So CER, you can you already know it. It is 36 deaths happened out of 120. So 36, 12 threes are 36, answer is 0.3, right? So event CER is this much and EER is this much. So step number 3, that is to calculate the number needed to treat. The number needed to treat is given by a formula 1 divided by the absolute risk reduction. So let me calculate first the absolute risk reduction. Absolute risk reduction is given by the formula CER minus EER. That is 0.3 minus 0.2, that is 0.1. So what is the number needed to treat? Number needed to treat. Number needed to treat. That is number needed to treat or number needed to harm. It is just the inverse of it. When we take the number needed to harm, that is how many people you will need to induce death in somebody, that we calculate number needed to harm. But this MCQ was asking how many patients you need to treat to avert death or decrease the death rates by 1. That means number needed to treat, it is given by the formula 1 divided by the absolute risk reduction, that is 1 divided by 0.1, that is 1 divided by 0.1, that is equal to 10. So what is my answer? I need 10 people to treat with this new treatment so that at least 1 death is averted. That is what it technically means. So this is a simple way to calculate the number needed to treat. You can see on your screen that number need to treat is pretty important. It's a very important phenomena you need to remember. It has been asked so many times in case you are appearing for your MLE exams, in case you are appearing for your PLAB exams, again, this number need to treat is a very important statistical method that we use very often in the exam to test the students for their preparation level. So, in a study with new treatment, there were reported 36 deaths, treatment failures out of a sample of 120. And with the new treatment, 26 failures were there. How many patients would be needed to avert one death? Answer is pretty simple. We have done it. Answer we have deduced is number 10. Question number 3. Let's go to it again very quickly. I am sorry for my diagram. It's a kind of blurred, but I'll try to zoom in for you so that all those who are watching this video on a screen, on a smaller screen, can also see it. A study was done to assess for the risk factors for breast cancer in 100 females from urban cities. A statistical graph is shown below. So you can see that there were a couple of risk factors given in your MCQ. I am giving you a reconstructed MCQ. It is not at all the same MCQ. I have tried to give you the best possible replication of that. So on one side, they were written as small values. Some people got confused regarding were they p values, that the probability values, or they are actually, usually we use plot the odds ratio, and this is a typical example of multiple logistic or linear regression. This is regression analysis where you take all the data together at the same time, you take all the odds ratio. So I'll give you a very simple way to approach this question. They had asked how many risk factors you can see. So there is a general guideline you should follow. Whenever you get this MCQ, whenever I see a research, whenever you as a researcher will see a research in a journal, what we see? We see that there will be thousands of risk factors. For bone cancers, there will be thousands of, for osteoporosis, thousands of risk cancer. For retinopathies, diabetic retinopathies, there are thousands of risk cancers, millions of risk cancers, risk factors can be there, right? How to assess which one is an important risk factor, which one is not? Statistically, what we do is we take all the odds ratio, we put them into a regression analysis, we come out with a common odds ratio for every risk factor, and there is a 95% confidence range. So the guideline number 1 is that whenever you get this question, look at the 95% confidence range. Can you look at this first range? Whatever the data is, see, statistics, don't worry about what number they are saying. Don't worry about the variables, worry about the numbers. We talk in numbers and stats. So can you see the number in this? So if you see, look at the first odds ratio, you can see that it is 1.2 to 1.9. You already know from your background knowledge that odds ratio 1, what does it mean? 1 odds ratio, it means there is no association. Plus more than 1 means there is a positive association, less than 1 means there is a negative association. So try understanding that in case the 95% confidence interval, if you remember from my biostats class, I told you 1 SD is 68, 95 and 99. Now try understanding that if it is within 95% confidence interval, the odds ratio ranges how much? 1.2 to 1.9. That means, can't you say that if I plot the odds ratio on a scale, let me just plot the odds ratio on a scale like this. So at the center point there is 1. 1 odds ratio means no association. Then there is 1.1, 1.2, 1.3 and so on till infinity. Behind it is 0.9, 0.8, 0.7, so on. Now try understanding this particular first risk factor. Where does it fall? This risk factor falls where? It falls between 1.2 to 1.9 somewhere. So that means all the time it was a positive odds ratio. This odds ratio, this risk factor, whatever it was, I have put it as early menarche. This risk factor is a promotive risk factor. It may cause breast cancer or whatever disease we were discussing. Are you getting this? See, the odds ratio is 1.3. But once you see the confidence interval, if it does not contain the value 1 on this scale, I hope you're getting this. Try to imagine it on a space that the 1 value should be there. In case it is there, that means this odds ratio is a non-significant odds ratio. Sometimes it was positive, sometimes it was no association, sometimes it was negative association. It should be always either on positive side or on plus minus side. The range, the confidence interval. So let me just go ahead and you'll learn something more. into it. If you see the second, so first, what do I interpret it in? Odds ratio 1.3, that means a positive odds ratio. The confidence range is all in positive, that means it is a positive. My comment on this is a positive odds ratio. This is a positive odds ratio, and this is a risk factor. It is a risk factor, and it is significant risk factor. Three interpretations out of this line. First line number 2, can you just zoom in and see it? So if you just zoom in and see it, the odds ratio of whatever it was, it is 0.04. 0.04. It ranges from 0.01 to 0.32. It is all the time negative. The odds ratio, median odds ratio, is also negative. That means what? This is a negative risk factor. This is what? This is a negative risk factor. It is not a risk factor, it is a protective factor. And it is significant. Why? Because why do we say significant? It is negative all the time. Second, third, if you see this odds ratio is 0.5, it ranges from 0.02 to 0.9. It is also a negative odds ratio. It is a protective factor. It is again significant. It is all the time negative. If you look at the third, this third is a positive association 1.9. It ranges from 1.1 to 2.8. It is a risk factor and it is significant again. Next, the odds ratio is 1. So obviously this odds ratio means no association. The odds ratio is 1.4. Next, the odds ratio is 1.4, but now look at the confidence interval range. It ranges from 0.5 to 3.5. Sometimes it is 0.5 protective factor. Sometimes it is 1 no association. Sometimes it is positive, that is risk factor. This type of factor, high socioeconomic status, it does not carry any meaning. Sometimes it may prove to be a risk factor in some studies, sometimes it won't. It is largely dependent on many other variables. So therefore this odds ratio is null and void. We don't use this odds ratio. This is not significant odds ratio. It is not significant. Next, if you see, it is 1.24, ranging from 1.1 to 1.7. It is also a positive risk factor and it is significant. 0.3, 0.01 to 0.9, it is also a negative protective factor. Protective factor, it is negative, it is protective factor, and it is significant. So that's it. That's what you had to do. How many factors are risk factors in this study? So I can see that how many are risk factors. Risk factor number 1. Number 2 is a positive risk factor. Number 3 is I can see 3 things as a risk factor. Other risk factors are not typical risk factors. They sometimes showed, they sometimes not showed. I would like to mark option 3 over here in my MCQ exam. Next, question number 4. So look at the image below to find the corresponding option. So this was a very easy direct MCQ. I do not have anything to discuss on this. I think everybody in the whole country, everybody knows we had had a lot of discussion during our PSM classes. I discussed them a lot. There is an equation that is y is equal to a plus bx plus e is for error. So just for your exam purpose, I'm saying we talk about errors. Generally speaking, we take y is equal to a plus bx. Generally speaking, this is the formula that you need to remember for regression. It is very easy. What is y? Y is the regression coefficient. It is the regression variable on which we are going to. What is regression? I'll take 1 minute of yours just to tell you, because I have that thing coming inside me that I want to share with you, all the students who do not know regression. I want to share with you what is regression. Regression is, see, if I have this x variable on this horizontal line, I have some variable. It goes at this point, whatever point. Then on y variable, on y axis, you have some variable. It goes here, 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 whatever. We are not bothered. Regression means, can you tell me that at the junction that I am pointing on your screen, wherever it is, at this junction, can I find out what is the value? Can you tell me the value of y which will be at this junction. If I tell you this x value, can you tell me and calculate the y value? That is what is regression. Regression means extrapolation. Regression means to predict a value based on another value. That is known as regression. So how do we regress? We have a regression variable. We want to find the y. A is the intercept. Intercept means what? If I take a ruler and just place it on this line, on this horizontal line, if I place a ruler on this horizontal line, I find that it meets the y-axis. It meets the y-axis at what point? It meets the y-axis at this point, at point number 10. So if you just extrapolate it down, you will see that it meets at 10 points. So that is known as the intercept on y. Okay. B means the slope of the curve. It tells you how much the curve sloping is. It is based on the correlation coefficient. If you remember from your correlation, how strongly the correlation. If it is direct 45 degrees, it is one correlation. Slightly lower, it comes out to be lower. So anyways, don't go into a lot of maths. Right now for your AIIMS exam, this was the question. You need to know this equation. B is the slope of the curve. X means the regression variable. So that is what this question wanted to test you, that do you know what is this formula. Of course, there's only one option which fits into it, that y is equal to a plus bx. Option number C, as you can see, this is the only one which is fitting into it. And this looks at somewhat like this, that the intercept is 11, right? Intercept is 11, 2 is the slope of curve, x is the value. So it's pretty simple and direct question. You need to remember y is equal to a plus bx. Question number 5. Question number 5 was based on correlation. The bone mineral density along with gestational curve was plotted in two different graphs were given to you in your exam, and you need to find out that which is more strongly associated. So we see that the strength of relation is same in graph A. Let me call this as A and this is B. So now if you look at this graph, you can see that the curve is something like this and the values are located just around the curve, as you can see in this graph, that the values are located just around the curve. That means they are very much densely populated. But if you look at the other curve, if you look at this curve, it says that this is the curve. Now the values are sparsely placed, as you can see here. Yeah, like somewhere you'll have the values, somewhere other side. These are like scattered values. They are not very nicely correlated. So what type of correlation? Of course, the vector looks like this, but this type of correlation is a non-significant. It is a very less correlation. The strength of correlation is very less. Whereas in this curve, you see the values are very near to it and the variation is very less and they are more closely compacted. So we say this is a stronger correlation, whereas this is a weak correlation. Okay. So if you understand this, now let us come to the MCQ. The bone mineral density was plotted from two. Strength of relation is same in A and B. Strength of relation, as you can see, is not same. This is false. Strength of relation is more in A than in B. This is a true statement. Strength of relation is more in B. Of course, this is false. Variation in variables. Yes, there is a variation in variables. More with A. No, it was less with A. So this also is false. So the best answer, the true answer would be that the strength of relation is more in variable A as compared to the correlation B. Question number 6. Now this question is pretty important question. I think maximum request that I had got on social media was for this question, that how to approach this question. It was very easy question. See, just relax, think for a moment. A study was conducted to assess the effect of intervention for certain disease. The p-values for two similar researchers, A and B, with 95% confidence interval was found to be 0.02 and 0.01. That's the end of MCQs. Everything is being told by these two p-values. First thing, as I see the p-values, what did I teach you? I told you that whenever you see the p-values in exam, always think of if the p-value is less than 0.05, that means what? If it is less than 0.05, what it means? Within the normal zone or outside? It means if it is less than 0.05, these are outside the normal zone. These are significant p-values. Are you remembering this? If it is more than 0.05, it is non-significant. So now the researcher has given you 0.2 and 0.001. Both are significant. Which is more significant? So logical answer, which is more significant? 0.01 of course lies more farther away in a normal distribution curve, right? You remember that normal distribution. So obviously this we say is a highly significant. It is a highly significant p-value, whereas this is a significant p-value. That means there is more stronger association. You remember the alpha values, you remember the alpha errors, 0.0001, 0.001, that means what? It is 0.1 alpha error. There is less than 0.1% chance that I am wrong, and I am very confident, 99.9% confident that this value is lying at that particular point. So this is what, which means that 0.001, it is highly significant. I'm pretty sure that my research has brought out the actual or the true value. So if you understand this, now let us see the options. Study B, I'll read it very slowly. Study B is more precise than study A. Is it true? I think so, yes. The intervention Y is more significant compared to the intervention X. Is it true? I think yes. So I would like to mark this as true. So just hold. I'm pretty okay that the option A is true. Why? Because study B is 0.001, highly significant. Y is more significant intervention? Of course, it's true. Studies A is more precise. No, A is not precise because it has a lesser significant compared to B. And X is more significant. This is false. X and Y show a significant variation. Yes, they do show. But the study B is more significant than study A. So X and Y show a significant variation. They do show a significant. Both are significant, right? That's what I have written. Both are significant. Study B shows more significant. So I agree to this. I agree to this. This is also true. Both study A and B show significant variation. Yes. And both interventions have similar statistical significance. Now, both do not have the same statistical significance. Why? Because A has 0.02 and B has 0.001. So why do you want to say that both are same? They are not same. This is wrong, false. Data is not sufficient. No, they are, like I would say data is actually not sufficient. But for this MCQ, I would not like to mark E option because data is there. The question wanted to test whether you understand the p-values, yes or no. So yes, we do understand the p-values. I would like to mark A and C as my correct option. So we have that answer over here. A and C both are correct. That's what we can mark in this question for the exam. Sample question number 7. These are all reconstructed sample questions. Don't take them very, very much literally. That I want to discuss the topics with you and not the MCQs. Question 7. The study was conducted in 2 different samples. Sample A had a mean of 110 plus minus 11. Sample B had a mean of 18 plus minus 3. So wow, that's a big difference. So I see that it is 110 plus minus 11 and you want to compare 18 plus minus 3. You want to compare these 2 things. So that's which of the following has more variation? I don't know. How would I know? See, the standard deviation for 110 is too much. But the mean was also 110. So anything which has normal values as 110 plus minus 11 is okay. 18 and plus minus 3 is also okay. I don't know. So how to calculate, how to attempt this? This was a very simple question. You all have done it during your classes, that whenever we talk of variation, either calculate the coefficient of variation or we calculate the standard errors. You do not need to calculate the standard errors because standard errors we calculate whenever there is p-values, whenever there is confidence interval, we calculate the standard errors whenever we want to compare the data. Over here, we are not comparing the data. We want to find out which has more variation, called as coefficient of variation. If you remember the formula for coefficient of variation, I told you in the class, I helped you in the formula sheets also. Coefficient of variation is given by standard deviation over mean into 100. So what do we have? Coefficient of variation in sample A, CV for sample A is standard deviation 11 by mean 110 into 100. So leave aside 100. So this is like 1 by 10 or 0.1, or it is 10% variation. Next is coefficient of variation in B, sample B. The standard deviation is 3, the mean is 18. So 3 over 18 is 1 by 6 into 100. So that would come out to be roughly around 16%. So that is what. So what do you think? Coefficient of variation is more with which sample? The coefficient of variation is more with sample B as compared to sample A. So this B sample varies a lot. This A sample is closely knit. That is what it means. So sample A has more variation or sample B? Sample B has higher variation. Why? Because it has a coefficient of variation of 16%. So sample B is more variating than sample A. So this has higher variations. Question number 8. Seasonal variation of disease studied in children in a group in June, July and in August, September in another group of similar characteristics from the same areas. Seasonal variation of a disease studied in children in a group in this from another area. So that's a pretty simple question. There are two groups they had taken and both groups were studied somewhere in June, July, again in August, September. So you are comparing two seasonal variations in two different groups. Group A, what happens in June? Group B, what happens in June? Group A, what happens in September? Group B, what happens in September? You are comparing this data. Simple. This is, you are comparing what? I am comparing the prevalence of the disease. I am comparing the number of cases, number of disease, number of deaths. I am comparing the infant death rates, whatever I want to compare. So I am comparing that. My answer is chi-square test. This is a simple example of qualitative data. So for qualitative data, two groups, I told you 99% people will ask you about paired t-test, unpaired t-test or chi-square. So here we are in your AIIMS exam. We got this question on chi-square test. Paired t-test is a paired t-test. It's a test of significance which we use for quantitative data, where we do pre-post analysis, where you have a single group, you do before and you do after. Wilcoxon rank test, we do it for ordinal data, wherever the question is saying that we'll compare the mild, moderate, severe, hot, hotter, hottest climates and things like that. ANOVA, analysis of variance. ANOVA test is done for more than 3 groups and it is done for quantitative data. So my best answer over here would be a chi-square. Simple question, simple answer, which is the test of significance to be used here. Question 9. So you've got a lot of questions on biostats. Study design of choice for testing circadian variation of fat content in express breast milk of mothers of preterm infants. Case control, prospective, ecological, cross section. So I've got an update that probably this is not ecological, it was ambispective study, ambispective cohort. So you can whatever. So this was an option change. So anyways, two school of thoughts. Some students were getting confused that why is it not cross sectional, why is it cohort, ambispective or prospective. See, if I want to do a cross sectional, I will take 100 females today. I will check their fat content today. I'll take another 100 females next time. I'll check their fat content. So it's like a cross section study. But now, what is this question? Study design of choice for circadian variation of fat content. So you are checking a mother morning, evening. You are checking a mother next day morning, evening. So you're checking 100 mothers in morning, you're checking 100 mothers in evening. Circadian variation of fat content in the expressed breast milk of mothers of preterm infants with their age. So within first month, what was their fat content morning, evening? Second month, what was their fat content morning, evening? You take You do not take a cross section. You do not take a snapshot of the population. You are taking a group of mothers who had similar characteristic, that is preterm infancy. Their child was preterm infant born, and you followed them up with sequential follow-ups every day to do check for their circadian variations in their fat content of the expressed milk. So what does it mean? It means you're taking a group of females with common characteristics. It's a direct indication that you're doing a cohort study. Second, sometimes students ask me on the social media, why is it not ambispective? We did not take the mothers back and we asked them that what happened in the milk, or we could not. This is a simple design. You take 100 females today and let's start the study from today onwards, because you're going to check for the fat content of the milk. So in no way you can take some medical records. Nobody is going to do fat content already done in the express milk. Nobody does that. So if you're planning to do a study, you do a study from today onwards till the next time. So obviously it's a simple answer. I don't think we need to bang our head on it. It's a simple answer. It's a group of females taken and we do a follow-up. It's a simple prospective cohort. Just to confuse you, they had given the option of ambispective cohorts. What are ambispective cohorts? It means retrospective and prospective, both elements are there. So there is an element of retrospective and there is an element of prospective. So that's why I would not like to choose ambispectives. I would not like to choose case controls or cross sections. Next question. So that's all for the questions on biostats and epidemiology. Thankfully, we are almost done with that. Now we have another group of 10 MCQs coming over from public health and preventive medicine for you. Which immunization is useful in a post-disaster phase? Direct question. I think we have taught this a lot of in our classes. I discussed immunization for roughly around 2 hours. That which immunization is to be done in the what circumstance. I don't know what the examiner will ask you. You need to be trained on these phenomena. Which immunization is important in post-disaster phase? I always told you, the examiner will compel you to mark cholera. They will even write down diarrhea outbreak, but still cholera is never given. Typhoid is not useful. Polio can be given only in polio outbreaks. We give oral polio vaccines. In post-disaster, usually disaster means floods or earthquakes or natural calamities, there is a higher chance of most common disease happening is gastrointestinal disease. So you have a high chance of gastrointestinal infections amongst the children, and there is a higher chance of measles disease outbreak in case you have less than 85% coverage. So in case the 85% coverage is very less, or in case the area was lacking in some immunization coverage areas were not there, so in those cases the chances of measles outbreak does happen. So therefore it's a universal mandate in disaster phase. Stick very close monitoring, do very close surveillance and monitoring for the measles vaccine. It's a very important vaccine that should not be missed out. For healthcare professionals, this question was not there. I'm just telling you, for healthcare professionals, it's important to have them immunized for hepatitis B and for tetanus toxoids or tetanus diphtheria. That's the current WHO recommendations for people who are in emergency response towards disaster. They need to be protected for these diseases. Whereas the general community, you don't need to vaccinate anything. It creates unnecessary panic. It gives you a sense of comfort. It gives you a sense of security from the disease, which in reality does not happen. However, you should be thoughtful about the measles vaccine, that it should be monitored and can be given in case you are thinking that the measles coverage is low. Question 11, MW vaccine. I know that's not a very comfortable question. It's a little bit historical type of question. Earlier, like leprosy bacilli was Mycobacterium W bacilli. So that's why it is also called as MW vaccine, or the Mycobacterium indicus prani vaccine. MIP vaccine for leprosy is MW vaccine. So nothing very special, and we need to just remember it. It's not Bovis. Bovis strain is for BCG. BCG is Danish 1331, derived from the Mycobacterium bovis type. And that was not the question. The question was MW vaccine. MW vaccine is Mycobacterium indicus prani vaccine. program for increasing the quality of labor room care. So there are a couple of questions on this. If you want to increase the maternal and child health services, what do? We have for MCH care, we have the reproductive maternal neonatal child health plus adolescent program. Very lately, very recently, for good ANC coverage, for very good ANC is antenatal care. We started with the Pradhan Mantri Surakshit Matritva Abhiyan. It was that on 9th of every month, there will be free ANC checking at all the PM SMA empaneled hospitals, and there will be the quality of ANCs will be upgraded. The quality of labor room, how good the labor room facilities are, how good the trained staff is, how good the trained health personals are, and how many instruments are there, what are the devices which are there. All these are being tackled under the Lakshya program, labor room quality, LAQ, labor room quality assurance program. So that is what is a Lakshya program. Ayushman Bharat scheme, I think we have had a couple of videos on that also. So if you have not watched, you can just go to the video section and watch for the recently launched program videos. You'll find a lot of questions on Ayushman Bharat. It is nothing but a health protection scheme given to 10 crore families or to 50 crore population. 5 lakh rupees health protection cover to 50 crore population for any disease, primary, secondary and tertiary healthcare. All cancers, cardiovascular disease, everything included. So the answer to this is Lakshya. So let's come to the next MCQ, question 13. State which of the following statement is true and false for AFP surveillance. Surveillance only till 5 years of age. Of course, there's a wrong option. It's not done till 5 years. It is done till 15 years. Any child who is still 15 years, we will do the AFP surveillance. So surveillance done till 5 years of age, this is a false option. It is till 15 years of age. Sample collected for AFP even after 15 years. No, not after 15 years, till 15 years. So both are false option. At least one case of non-polio AFP should be detected annually per 100,000. That is correct. The AFP reporting rate should be more than one case per 100,000. That AFP could be anything. It could be Guillain-Barré, it could be traumatic neuritis, it could be enterovirus, it could be polio also. So at least one case of AFP should be detected per year out of 100,000. This is in fact the target of the pool. It would have been better if the recall, this is a recall option, so there are chances of error. So at least one case of non-polio I would like to strike off. I asked the students, so they said non-polio was there. Anyways, I personally would recommend putting AFP as the option. Stool sample should reach the laboratory within 72 hours. Perfect, right? Listen to it carefully. The first sample should be collected within 48 hours of reporting. So very commonly students make this mistake. First sample is collected not within 24 hours, it is collected within 48 hours of reporting. Second. The second sample is collected at least 24 hours away from the first sample, 24 hours apart from the first sample, but within 14 days. Within 14 days. The sample both should be collected and sent to the laboratory within 72 hours. There should be more than 80% adequate stool sample, and at least 80% should have 60 days residual paralysis check done. So this is for the residual paralysis should be checked at 60th day in more than 80% of the cases. That is what is the target. So all are true. So I would like to mark C, D and E as my true options. So my true options are C, D and E, and A and B are my false option in this question. Question 14, it is all-time favorite. Every exam I've seen this, and I think you must have been ready for this question. This is a very straightforward question. Yellow color, what category? Red, blue and white, what category? I have good videos on this. So I would recommend you to go and watch the video on my YouTube channel, and it will help you a lot. So biomedical waste management, match the following, direct MCQ. It's there in many books, and I've also put it updated in my book. So you can do it anywhere. Yellow, please remember, is for anatomical waste, animal waste, cytotoxic waste, every kind of waste which is incineratable, plus the cytotoxic category, the chemical waste, discarded medicines, they all are under the yellow category. So yellow category, I would like to mark with what? Glassware, no. Scalpel, no. Cytotoxic, yes. So I would like to mark A with the third one. Red category, you would like to mark with what? Red category is all rubber, tube and plastic. So glassware, no. Scalpel, no. Cytotoxic, no. Globe, maybe. Syringe wrapper, globe, I don't know what globe they were talking. So syringe wrapper, definitely R goes, red goes with the 5. So this goes to the red category, and the cytotoxic goes to the yellow category. Blue thing, blue is what? Blue is for glass. So all glass plus metallic implants are discarded in the blue category. So this one goes to the blue. So we have C1, B5, A3, and the white category is sharps. So white will go for all the sharps plus all the metals. So D is with the 2. So it's a direct question, biomedical waste, match the following. Regarding functions of ASHA, all are true except. So this was a funny MCQ. It was an important MCQ. I don't know, like many students have complained that they were not able to do it. But it's a very direct question. So all those who could do it, I'm 3 cheers for you. So you already have scored very nicely, and you're way beyond the other student. So good job done. Regarding functions of ASHA, we all know ASHA is a voluntary worker, incentive-based worker, 25 to 45 years of age, and she does all the work at the village level, grassroots level for the community. She is not a trained functionary for immunization. She does not treat diseases, but general healthcare conditions can be managed by ASHA workers. She facilitates immunization, absolutely true. She accompanies pregnant females to the hospital under the JSSK scheme, absolutely true. Spreads awareness about contraception, the new initiative when launched in 2017 under the AASHA, ASHA contraceptives, that the ASHA's workers will go door to door, and they will have the home delivery of the contraceptions. So spread awareness of contraception. Of course, this is one of the main functions of ASHA worker. Malaria slide preparation is not done by ASHA. It is the work of a MPW male. Immunization, she facilitates for immunization. The camp should happen, the children should come, the ANM should come, the health workers should come, and there should be a good progress, report should be written, everything is being managed by ASHAs. So malaria slide preparation is done by the MPW male. Question 16 was an image-based question. This insect transmits all of the following diseases except. So that's again a good question, and of course this was an expected question, and we had quite a long word in the class also, but there were a few points which was added in this MCQ which I liked about this MCQ. Everybody knows KFD is a tick-borne disease. It is caused by both the hard tick as well as the soft tick. So we all know about KFD, Cazenove forest disease, is a tick-borne disease. Kala azar is one answer, which is a sandfly. This looks like a sandfly, right? I think we have done in the class how to identify a sandfly. Sandfly would be a hairy insect. It will have a lot of hair, and this is smaller than a mosquito. It is not at all a mosquito. So this is a sandfly. So Kala azar is a sandfly-borne disease. Babesiosis is not caused by sandfly, but there is another thing, that is Chandipura encephalitis, which is again a sandfly disease, and oriental sore, which is also sandfly disease. So everybody knew about oriental sore and Kala azar, but Chandipura encephalitis. Chandipura is a small town, and it's a small community in Gujarat where the encephalitis was reported, and was predominantly because of the sandfly species. So that is something new for us to learn, something new for students to learn. This was a new inclusion into the AIIMS paper, that Chandipura encephalitis was a new question for us all. So that was one option which you can remember, right? So we come to the next MCQ question 17. What is the sequence for removal of the personal protective equipment? So whenever there are WHO criteria and there are CDC Atlanta criteria. So criteria are that whenever you enter into an isolation area, or whenever you enter into an area where the universal precautions guideline are to be followed, or the protocol is to be followed, there is a sequence in which we do. So whenever we enter, on entering, the first thing that has to be done is wearing an apron. So apron has to be worn first, apron or a gown. Followed by that, we wear the face mask and the goggles, right? So we wear the face mask. Followed by that, we wear the goggles or the eye cover. Followed by that, and in the last, you have to wear the gloves, right? So that is the way to enter. So you don't wear the gloves and then you wear the goggles. You wear the apron and then you wear the face mask. Then you wear the goggles and then you wear the gloves. So that completes your entry phenomenon. Now, once you are exiting, on exit, how to take them off? So there are a couple of ways in which we can take them off. The first, let me not discuss too many ways. The WHO has their own way, the CDC has its own way, but in nutshell, the combined criteria is, first you need to take out the bigger thing. First you need to take out the apron or the gown. Gown or the apron needs to be taken off with the gloves. So usually then there is a discrete WHO criteria, there is a separate CDC criteria. So in both the criteria, the nutshell is you need to take off the apron. A certain type of example is you can take off the apron with the gloves also. So you take off the apron, turn it inside out, and you take off the gloves along with it. In certain situations where people are wearing the rubber shoes or the overshoes also. So in those cases, you take off the gown, then you take off the overshoes, and then you take off the gloves. You wrap everything up in the same apron and you discard it. Then you do hand wash or hand hygiene. Okay, so once you take off the gloves, still you're wearing the mask and you're wearing the eye cover. So mind it, I have not removed my eyewear and I have not removed my face mask. So we remove the gown or the apron along with the gloves, or you can remove the apron, your shoes, and then you take off the gloves. But anyways, you just wrap them up, discard them, do hand hygiene. Now after this, you remove the eye cover, and in the last, you remove the face mask. So you remove the eye cover or you remove the goggles. First, you remove the goggles, and from behind, you need to take them off like this. So from behind, you just take them off. And then in the last, we have the protocol says that in the last, you need to remove the face mask also. So the face mask is usually removed not inside the isolation room. You need to exit the room, you need to close the door, and then take off the respirator. First, the lower strings should be loosened and then the upper strings to be loosened. So there is a way to loosen your face mask or the respirator also. So that's the way we have the CDC or the WHO guidelines for removal of the personal protective measures. So that's what this question, simple question was. What is the sequence for removal of the personal protective measures? What do you want to say? First, we will remove the apron. So 4 number goes first. Followed by that, you will remove the gloves. Followed by that, we will remove the eye care, and followed by that, we will remove the face mask. So that's how we remove it: 4, 2, 3, and 1. Last question is, according to the Commission on Chronic Illness, year was given. So we already know it was in 1949 and 1956. Chronic illness was defined as impairment with more than 3 months duration with residual disability, irreversible pathological alteration, or significant impairment. So chronic illness, the guidelines have changed. So it's a long way. We have come over more than 70 years now from the Commission on Chronic Illnesses. Now there are WHO guidelines. which are being followed. So earlier, the chronic illness was defined as anything which is of more than 3 months duration, which stays with us for a prolonged time. There is no criteria. There should be disability. It may be there, it may not be there. Impairment may be there, may not be there. Pathological alteration, they all mean the same. They plus or minus. But there is a disease which stays with you for 3 months, and it may go off or it may not go off itself. So, for example, cancer, it's a chronic illness. For example, diabetes, it's a chronic illness. Hypertension may happen, it may recede as well, right? So, also oral diseases, oral tooth decays or periodontitis, these are all classified under chronic illness. So, anyways, for this question, it was simple question, simple answer. According to Commission of Illness, chronic illness is anything which is defined as more than 3 months duration. I would like to enlighten you. I would like to bring to light over here one small point, that according to the CDC Atlanta guidelines, anything which is more than 1 year is taken as chronic illness, but that is only for CDC Atlanta. The WHO guidelines, the American guidelines, the European guidelines, the Australian guidelines, everybody sticks to the Commission of Chronic Illness. More than 3 months, we call that as chronic illness. So CDC is particular in the sense that there's a lot of budget involved. There are monetary financial liabilities as well, along with the chronic disease. So they might have probably taken that as criteria. But anyways, this question is pretty simple. I would like to mark option one, as my best option. So with that, I have done all my discussion of all the AIIMS MCQs asked in AIIMS May 2019. These were all recall MCQs, so don't get disheartened if your option was not there. I'll be more than happy to include it in the videos again. And please, any corrections that you feel, you are more than welcome to put it in the comment box below this video, and I'll be happy to share my views, you share your views. All the very best for any upcoming endeavor. Best of luck, study hard, stay focused, and keep on revising. That's the golden rule for you. Thank you so much.